Hi, I'm Dr. Ronald Bush, and welcome to our first course in the ambulatory venous surgery series. Today we're going to discuss venous ulcers. This is a very difficult problem, and a very difficult problem to manage both for you and for the patient. And I think some of the things you'll learn today will really help you in your management of this very difficult clinical situation. The etiology of venous ulcers are multifactorial. However, the common denominator is venous hypertension. This is a local manifestation of a systemic problem. Prolonged venous hypertension leads to microvascular pathology with resultant chronic inflammatory changes. An ulcer may occur because of this chronic inflammatory state. The TIRS technique is terminal interruption of the reflux source. This is the basis of this course. And as we do the lecture, keep in mind that there's a new paradigm in the treatment of venous ulcers that we'll be discussing. This is an example of a venous ulcer, actually the first one that was treated with the TIRS technique. This is actually by accident. This patient had an ulcer present for over 2 years. She had had a previous high ligation stripping with a persistent venous ulcer. 6 weeks after doing foam injection of a Cockett's perforator, this patient had a healed ulceration. However, she had a patent Cockett's perforator. What had closed off was the terminal branches leading from the ulcer to the Cockett's perforator. This was my first tip-off that something else was occurring rather than the previously held opinion that this was secondary to reflux through a Cockett's or through a saphenous vein. These are actually refluxes through the terminal branches and high pressure secondary to the reflux in these terminal branches, not necessarily the perforator or the saphenous vein itself.